This is a case of inferolateral wall MI, and you can see right here that the artery is diffusely diseased, the LCX, and the wiring was particularly quite difficult. There was this area where the wire was not going very smoothly, and you can see that the bend has a lot of bend. Anyways, so we took a balloon support right here, and this is a BMW wire. So we usually use our workhorse wire first, and if the workhorse wire does not go smoothly, then only do we go in. And the workhorse wire tried very smoothly after the balloon support, and you can see the artery not opening very well, so we did a pre-dilatation somewhere right here. You can see the pre-dilatation happening. Alright, so after some pre-dilatation with a 2 by 15 mm balloon, the artery opened up quite nicely, and we have to use a long stent. I think this was the stent positioning that we used. Stent opened up quite nicely right here, and the artery also opened up nicely. We did a post dilatation. The post dilatation was with a 3 by 15 mm NC balloon. The stent was about 3 by 36 millimeters. Impressive post dilatation right there for about 20 seconds each time. And I think overall the results have been quite nice. Post dilatation right here. And the artery opened up quite nicely. You can see. The results were excellent, and the patient did quite well. So let me just show you the first result and then the final one. So this was how the artery was before. Diffusely diseased, not very good, and this is the final result. I think the result has been wonderful. It's explained well, and the patient did well. Thank you, Dr. Rajat Rawat.